Here are 10 USMLE-style pharmacology questions related to infectious diseases, complete with explanations and answers. 1. A 35-year-old man presents with fever, night sweats, and weight loss. Sputum analysis reveals acid-fast bacilli. Which of the following drugs requires activation by mycobacterial catalase peroxidase, CATG, for its antibacterial effect? A. Pen. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. E. Streptomycin. Answer: B. Isoniazid. Here are 10 USMLE-style pharmacology questions related to infectious diseases, complete with explanations and answers. 1. A 35-year-old man presents with fever, night sweats, and weight loss. Sputum analysis reveals acid-fast bacilli. Which of the following drugs requires activation by mycobacterial catalase peroxidase, CATG, for its antibacterial effect? A. Isoniazid. C. Pyrazinamide. D. Ethambutol. E. Streptomycin. Answer: B. Explanation: Isoniazid is a prodrug that requires activation by mycobacterial catalase peroxidase, CATG. It inhibits mycolic acid synthesis, which is essential for the mycobacterial cell wall. Resistance can occur via CATG gene mutations, leading to ineffective activation. 2. A 27-year-old woman is being treated for a urinary tract infection caused by Escherichia coli. She develops Achilles tendon pain and is advised to discontinue the antibiotic. Which of the following was she most likely prescribed? A. Amoxicillin. B. Nitrofurantoin. C. Ciprofloxacin. D. Trimethoprim sulfamethoxazole. E. Doxycycline. Answer: C. Ciprofloxacin. Explanation: fluoroquinolones, e.g. ciprofloxacin, inhibit DNA gyrase, topoisomerase II, and can cause tendinitis or tendon rupture, particularly in older patients and those on corticosteroids. They are used for complicated UTIs but should be avoided in pregnancy and children. Cert 3. A 60-year-old man with a history of atrial fibrillation is diagnosed with Staphylococcus aureus endocarditis. He is started on an IV antibiotic, but his serum creatinine rises significantly. Which of the following drugs is most likely responsible? A. Vancomycin. B. Nafcillin. C. Cefazolin. D. Daptomycin. E. Linezolid. Explanation: vancomycin is nephrotoxic, especially when combined with other nephrotoxic drugs, e.g. aminoglycosides. It inhibits cell wall synthesis by binding D-ala-D-ala residues in peptidoglycan. Monitoring trough levels can help reduce toxicity. A 5-year-old child with a sore throat and fever is prescribed penicillin. The antibiotic inhibits bacterial growth by targeting which of the following? A. 30S ribosomal subunit. B. 50S ribosomal subunit. C. Peptidoglycan cross-linking. D. DNA gyrase. E. Folic acid synthesis. Answer: C. Peptidoglycan cross-linking. Explanation: penicillin inhibits transpeptidase penicillin-binding proteins, preventing cross-linking of peptidoglycan in bacterial cell walls. This is effective against Streptococcus pyogenes, a common cause of pharyngitis. 5. A 48-year-old man with AIDS develops fever, headache, and confusion. CSF analysis reveals Cryptococcus neoformans. What is the most appropriate initial pharmacologic treatment? A. Fluconazole. B. Amphotericin B plus flucytosine. C. Caspofungin. D. Voriconazole. E. Terbinafine. Answer: B. Amphotericin B plus flucytosine. Cryptococcal meningitis is treated initially with amphotericin B, binds ergosterol, forms pores, and flucytosine, inhibits DNA-RNA synthesis. Fluconazole is used for long-term maintenance therapy. NASH 6. A 19-year-old woman is diagnosed with chlamydial cervicitis. Which of the following is the best treatment option? A. Amoxicillin. B. Ceftriaxone. C. Doxycycline. D. Azithromycin. E. Metronidazole. D. Azithromycin. Azithromycin, single dose, or doxycycline, 7-day course, are the first-line treatments for chlamydia trachomatis infections. Ceftriaxone is used for Neisseria gonorrhea, which often coexists with chlamydia. 7. A 45-year-old patient with infective endocarditis caused by Enterococcus faecalis is prescribed ampicillin along with another antibiotic that binds the 30S ribosomal subunit. Which drug is it? A. Azithromycin. B. Doxycycline, C. Clindamycin, D. Gentam, E. Linezolid. Answer D. Gentamicin. Explanation: aminoglycosides, e.g. gentamicin, bind the 30S subunit and cause misreading of mRNA. They have synergy with beta-lactams, e.g. ampicillin, against enterococcus by increasing cell wall penetration. 8. A patient treated for a parasitic infection develops disulfiram-like effects after consuming alcohol. Which drug was most likely prescribed? A. Ivermectin, B. Albendazole, C. Metronidazole, D. Praziquantel, E. Nitazoxanide. Answer C. Explanation: metronidazole, used for Giardia, Trichomonas, Entamoeba, Clostridium difficile, inhibits DNA synthesis. It can cause a disulfiram-like reaction when combined with alcohol, leading to nausea, vomiting, and flushing. 9. A 32-year-old man with HIV is diagnosed with pneumocystis pneumonia. His creatinine clearance is 20 milliliters per min. Which drug should be avoided or dose adjusted? A. Trimethoprim sulfamethoxazole, B. Clindamycin, C. Etalvaquone, D. Pemidine, E. Dapsone. Answer A. Trimethoprim sulfamethoxazole, TMPX. Explanation: TMP-SMX inhibits folate metabolism but is renally excreted and requires dose adjustment in renal impairment. Alternative treatments include etalvaquone or pentamidine. 10. A 65-year-old man develops red man syndrome after rapid IV administration of an antibiotic. Which of the following is the best way to manage this condition? A. Stop the antibiotic permanently. B. Administer an antihistamine and slow the infusion rate. C. Switch to daptomycin. D. Give corticosteroids. E. Administer epinephrine. Answer: administer an antihistamine and slow the infusion rate. Explanation: red man syndrome is caused by histamine release due to rapid IV vancomycin infusion. Slowing the infusion and pre